Hi, my name's Kristen, and I'm going to be performing a cardiac and pulmonary assessment on my patient here, Matthew. And I will go ahead and start with the pulmonary portion. We will first start by inspecting the configuration of his thoracic cavity. We'll notice that his musculature is even bilaterally, as well as it doesn't appear that he's using any accessory muscles to breathe, and no extenuous effort to do so. So then we'll go on to look at the symmetry of his shoulders as well. We will palpate those, and the muscles feel strong and equal bilaterally. From there, we will be looking for symmetric expansion, and we will palpate to feel that there's no trapped air. I might add that we're starting with the anterior, and we'll do some of these same assessments on the posterior side. So then we will do the tactile fremitus, and I'll start by placing my palm between his intercostals and asking him to say 99.
99, 99, 99, 99, 99, 99.
And this, we want to make sure that the vibrations are strong and equal bilaterally, and they are. It's not as much important that they are present in one place or another, but that they are symmetrical on each side. And in this case, that is correct. So then we will also look for any masses or tenderness. Let me know if you feel any tenderness. And he doesn't express any discomfort during this assessment. And then I will go ahead and start with listening to his breath sounds in all of his anterior quadrants. So when you feel my stethoscope touch your skin, just take a breath for me, okay? We could also start up here above the clavicle. And breath sounds are clear and equal bilaterally. I don't hear any wheezes or rhonchi in any of the quadrants. So from there, we will demonstrate the 3 ways to look for consolidation. We'll do this by having Matthew turn around. We'll listen to the breath sounds all the way down, and then we will look for the tactile fremitus. Okay, take a deep breath. breath when you feel my stethoscope. We'll listen in a box-like pattern, comparing one side to the next. Okay, again, breath sounds are clear and equal bilaterally in all quadrants of his lungs. I don't hear any thing that makes me suspect any wheezing or rhonchi. Then I will do 3 tests that test for consolidation. These would also, they could be done on the anterior side, however, they're generally done on the posterior side. So we'll do it this way. Normally you would pick one of these 3, but for this demonstration we'll do all 3. This first one is the whispered pectoraliquy. So what I'll do, Matthew, I'm gonna have you, I'm gonna listen to your lungs, and then when you feel the stethoscope touch your skin, then I'll have you whisper 1, 2, 3, okay? Okay. I can tell Matthew's speaking because I can see his head moving, but I can't hear any of his voice. In this case, it's a good sign because if we did, that would notify us there was some consolidation. Next, we will do the bronchophony. So then I will listen in several places and ask him to say 99. You say 99?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99 99, 99,
Okay. And then, the next test that we'll do is the egophony. We'll have him say E each time, and what we're listening for is that the vibrations don't sound like an A, because that could also represent the fact that he had some consolidation, pneumonia, or some other respiratory infection. Could I get you to say E each time?
E, 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 E.
Okay. And again, we could clearly hear that those were E's and not A's. Then we're gonna do the, go back and do the tactile fremitus. So I'll place my hand, on between his intercostals, and then ask him to say 99.
99, 99, 99, 99, 99, 99.
Okay? And again, those were clear and they were equal in each quadrant, especially one side matched the other, which is the most important thing. And then this concludes our, also I want to do some percussion. So I do that by placing my finger here, and I would tap, and then come over here, and because there's air in the lungs, we want it to sound a bit hollow. It does. If we're over the bone, it won't. It'll sound more dull and solid. Okay, I think you can go ahead and turn around. This concludes our pulmonary assessment. So then we'll move on to our heart, our cardio assessment. And we'll start by listening to each of the four, the aortic, pulmonic, tricuspid, and mitral valves. We'll identify the structures. We'll start on the right side with the aortic, move over to the left to the pulmonic, then down to the tricuspid, and then finally the mitral. We'll count the apical pulse there for 1 minute, and we will notate the rhythm and the rate. Come down, second intercostal space, right sternal border, and listen. we'll count the apical pulse. We notate that Matthew's apical pulse is 82 beats per minute. The sound is strong and bounding. And then finally we will go ahead and palpate his carotid on either side. To do that, we will go ahead and feel. And we might want to note that we would never do this on both sides at the same time. We can do it on either side or both, but never at the same time because it could potentially cut off blood supply to the brain and cause a drop in blood pressure. It is strong and bounding on his right side, so then we move to his left. And again, it is definitely strong and bounding. Then we would auscultate that same space. I'm gonna get you to hold your breath. Okay, it's strong and no presence of vertices on this side. Okay, could you hold your breath? Okay, and I don't hear any vertices on this side either. This concludes the cardiac portion of our assessment. Thank you for your time.